Hello everyone and welcome back to this third video which is in this series of the discussion regarding the cadaveric images. Today we are taking a very important topic here, and that is neuroanatomy. We'll be dealing with the sections of the brain, but before going to the sections, let me tell you that what our approach will be in these coming pictures. First, we'll be looking at the ventral aspect of the brainstem. As you can see here, it's a picture of the ventral aspect of the brainstem, and you can see the inferior aspect of the cerebrum as well. And we'll see what blood vessels can easily be marked there, the contribution of from the circle of Willis. We'll talk about the interpeduncular fossa, the boundaries, the contents there. Then we'll turn the brainstem and we'll look at the dorsal aspect of the brainstem. The dorsal aspect of the brainstem will be seen by removing the cerebellum. And once you remove the cerebellum, that means you're exposing the fourth ventricle. So basically our discussion from the dorsal aspect of brainstem will be on the floor of fourth ventricle and the boundaries of the fourth ventricle as well. Once we're done with this ventral and dorsal aspect, then we will start with the sections of the brain. We'll start with the transverse section. We'll see the corpus callosum, how the fibers are spreading, the internal capsule and the lentiform nucleus, etc. Then we'll also understand the transverse section at a different level. I mean, one ideal transverse section we'll take in which we can appreciate most of the important nuclei. And then we'll discuss a transverse section of the cerebrum slightly from a lower level so that you can appreciate few more structures which cannot be seen at all level simultaneously. We'll also be looking at the coronal section. In the coronal section, we'll be discussing the floor of, in fact, not only floor, the boundaries of the lateral ventricle. The lateral ventricle can very clearly be seen in the coronal section, and we'll be taking a section from the mid of the cerebrum, so somewhere from the body of the lateral ventricle. And finally, we'll be taking a sagittal section in which we'll appreciate the corpus callosum again, the different type of commissural fibers, and also boundaries of the third ventricle. So let's get on with this. So first image that you're looking at here is the picture showing the ventral aspect of the brainstem and the cerebrum as well. I'll be using this picture twice. First, in this image, guys, let us identify the important blood vessels here. So starting with the posterior circulation, now you can see this artery here is the vertebral artery. Again, I'll be giving the soft copies of these images, so just let me mark them in short. So that's the two vertebral artery you're looking at. As we know, the vertebral artery is a branch from the first part of subclavian, and these vertebral artery, after entering through foramen magnum, they meet in front of the upper part of the medulla oblongata itself. A basic tendency is that basilar artery is running in front of the pons. That is fine, but that doesn't mean basilar artery starts in front of the pons only. The formation of basilar artery is in front of the medulla oblongata. Look at that. That's medulla here, and that's a basilar artery formed in the upper part, in front of the upper part of the medulla itself. So this here is the basilar artery here. There are numerous branches from the vertebral artery. Vertebral artery is having a first, second, third, and fourth part. This is the intracranial part or the fourth part of vertebral artery, and the branches given off here are like anterior spinal artery, posterior spinal artery. We have medullary branches. But see, out of all those, the one that we can appreciate here clearly is this one. This is posterior inferior cerebellar artery. I'm sure you all read about this artery. We read about this artery in the Wallenberg syndrome also. It's a posterior inferior cerebellar artery, and it is the most tortuous artery in the human body, the posterior inferior cerebellar. So that's one major branch we can appreciate in this picture from the vertebral artery coming up. Once the basilar artery is formed, in the lower part, the basilar artery is giving off this another important branch which you can see here, that is anterior inferior cerebellar artery. Anterior inferior cerebellar artery as a variation can also arise from vertebral artery, but usually it is a branch of the basilar artery. And one information which I should give you here itself, that it's the anterior inferior cerebellar artery. In most of the cases, it also gives off the labyrinthine artery. It also gives off the labyrinthine artery. At most of the places it is mentioned that labyrinthine artery comes from the basilar artery, which is true, but most commonly it's a branch of anterior inferior cerebellar. It may come from basilar also. So if you're looking for a artery coming from a major artery coming from lower part of basilar artery or the initial part of basilar artery, that is anterior inferior cerebellar. Moving up in this picture, the basilar artery, it divides into the two terminal branches. Let me just enlarge this picture a bit more. Now look at this a very prominent terminal branch of the basilar artery, guys. This here is the posterior cerebral artery. Just before the termination into the two posterior cerebral artery, another important artery that you can notice here is the superior cerebellar artery. That's a superior cerebellar artery. So it tells me that cerebellum is supplied by the three major arteries. One is superior cerebellar artery, which is seen in the upper part of the basilar. And the two are inferior. One is anterior inferior, one is posterior inferior. Anterior inferior cerebellar branch of basilar and posterior inferior cerebellar is a branch of vertebral. And what another important thing to note about this posterior cerebral artery and superior cerebellar artery is that between these two arteries, the two important nerves can be seen coming out here. Now you can see this nerve, guys. This is the third nerve here. The third cranial nerve can be seen. And look at this, the thinnest cranial nerve, this one, that is a fourth cranial nerve. I hope you can appreciate that. The third nerve and the fourth nerve. Third nerve is coming from interpeduncular fossa, which we'll discuss next. And fourth is the only nerve coming from the dorsal aspect of brainstem. But that means both the nerves are actually winding around the cerebral peduncle. When they do so, they emerge out between the two arteries, that is a posterior cerebral artery and superior cerebellar artery. This is about the posterior circulation. These are branches from the posterior circulation which we can easily appreciate in any section, and because these are main arteries here, the anterior inferior, posterior inferior. Moving above, this comes the anterior circulation. There is an anterior circulation which is all about the branches of internal carotid. So guys, this here is the internal carotid artery. That's the trunk of the internal carotid artery. This is the fourth part of internal carotid artery, also called as the cerebral part of internal carotid. This internal carotid artery gives off a direct branch. A continuation of internal carotid artery is considered as middle cerebral. So this MCA, it is a continuation of the internal carotid, and this internal carotid also gives off this anterior cerebral artery as well. That's internal carotid giving off middle cerebral, and that is anterior cerebral. And I hope you can appreciate, and especially on this side, you can easily appreciate this artery here connecting the anterior, internal carotid artery to the posterior cerebral artery, that is posterior communicating artery. Although it's a very basic thing, but I've seen people getting confused with this posterior communicating artery. Posterior communicating artery, please remember, it is a branch of internal carotid. It joins with basilar. With the posterior cerebral, not other way around. It's not the branch of posterior cerebral. It is a branch of internal carotid, and then it goes and then joins with the posterior cerebral artery. So that's how the circle of Willis is formed. We have anterior cerebral, which is connected somewhere by the anterior communicating artery. We have posterior cerebral here, posterior communicating, and we have internal carotid. Okay, we'll talk about this fossa in a while in the next section here. This is a picture just to show the major branches that you should be able to appreciate in this view here. So the vertebral artery forming the basilar, dividing into two terminal branches, and the two major nerves. That's the important thing. The two important nerves, the third and fourth nerve, are seen emerging between the posterior cerebral and superior cerebellar artery. Well, beside the optic chiasma, guys, just lateral to optic chiasma, if you see this space here, this is called as the space, that space is called as anterior perforating substance. I'm just writing in short only, that is an anterior perforating substance. Posterior perforating substance is inside the interpeduncular fossa, somewhere here. That is a posterior perforating substance, which again we will discuss next. Now the one which is outside the interpeduncular fossa is the anterior perforating substance, which medially is having optic chiasma, that is present on the medial side, the optic chiasma. Posteriorly is having the optic tract, and laterally, look at that sulcus kind of thing here, which is basically the beginning of the lateral sulcus. If you start from this point onwards, that is the beginning of the lateral sulcus, and then lateral sulcus will emerge on the superior lateral surface and divides into the anterior division, ascending division, and the posterior division. That point, that region here is called as Lyman insulae. That's a lateral relation of the anterior perforating substance. That's a question also asked in the AIMS exam. The lateral relation of anterior perforating substance is Lyman insulae, which is basically the point from where the lateral sulcus begins on the inferior aspect of the cerebrum and then emerges on the superior lateral. What exactly is anterior perforating substance? Anterior perforating, as the name suggests, guys, perforating substance. It is a gray matter area which is perforated by some arteries here. Well, what artery? It is perforated by what artery you see closest? One is middle cerebral artery and anterior cerebral artery. So branches of anterior cerebral and branches of middle cerebral artery, they perforate this area and they go inside. Like one example I give you, if let's say the anterior limb of the internal capsule is supplied by the artery called as artery. It's a artery called as a recurrent artery of Hubner or Hubner's artery. Just don't bother too much about it. So that Hubner's artery is a branch of anterior cerebral. How that anterior cerebral artery branch will reach the internal capsules to supply the anterior limb? By going through this perforating substance to supply some deep structures inside, the one which are in the core. So the arteries have to go inside, and that's why they use these perforating regions here. So anterior perforating substance, it is perforated by the branches of MCA as well as branches of AC. That's about the blood vessel part. Now let me take you to this one important fossa which is present here, that is called as the interpeduncular fossa. It's a very, very commonly asked question about the interpeduncular fossa, its content. And there's another way the interpeduncular fossa is important, because if you know about the fossa, then you know a major chunk of third ventricle also. And you'll be like, what is about third ventricle here? How can we see third ventricle from here? Well, third ventricle floor is somewhere here itself, guys. Whatever you see in the interpeduncular fossa, majority of the structures will be seen in the floor of third ventricle. So this topic, interpeduncular fossa, is anyways it's important. So let me take you the same picture here, but I'm using this fresh image here just to discuss this region here, that is a interpeduncular fossa. Well, first of all, why do we call it interpeduncular fossa? It is present between the two cerebral peduncles, the two peduncles of the midbrain, which cannot be seen clearly in this image because we have all these small blood vessels present. So that's a side where we have the two peduncles, and in between those two peduncles, this fossa here is called as interpeduncular fossa. If I may start with the boundaries here, the boundaries of interpeduncular fossa, as you can see, it is by the first thing is the optic chiasm. The first thing that you see here is the optic chiasm. Then we have this optic tract. And the third thing is the cerebral peduncle, which is not to be seen. So I'm just marking it here somewhere. This is the region of the cerebral peduncle. That's the side of the cerebral peduncle. So these are three major boundaries of the interpeduncular fossa. The chiasma anteriorly, anterolaterally we have the optic chiasma, posterolaterally we got this cerebral peduncle. What are the contents, guys? The contents of this fossa, interpeduncular fossa, if I may start from here, you can see this cut section of the infundibulum. Well, you know what is infundibulum? The stalk of pituitary, that's the infundibulum. That is the one content here. Emerging from this tubular elevation here called as a tuber cinereum. The tuber cinereum which is present, and on that you can see the stalk of the pituitary, that is infundibulum. I hope you can appreciate these two ball-like structures there. These are nothing but the mammillary bodies. One of the component of limbic system where the fornix fiber ends, this is called as the mammillary bodies. And just behind mammillary body, you see this is the posterior perforating substance. We just talked about the anterior perforating substance. Now this here is the posterior perforating substance. What is posterior perforating substance? Again, you can very easily make out by looking at what artery is nearby. We already saw basilar artery divide into the posterior cerebral artery. So it's the branches of posterior cerebral artery which goes inside to supply core of the midbrain part and all. Those arteries are called as the branches of the posterior cerebral, forming posterior perforating substance. So guys, anterior perforating substance was the area which was perforated by the branches of anterior cerebral and middle cerebral, whereas posterior perforating substance is the grey matter area which is perforated by the branches of what? The PCA. That's posterior cerebral artery. That's the one which goes in. And finally, one more content that we have in this interpeduncular fossa here is this third cranial nerve. See, we already said fourth nerve is coming from dorsal aspect of brainstem. So you can see the fourth nerve here coming from the dorsal aspect. It's on the outer aspect of the peduncle here. This nerve, although it is coming out between this posterior cerebral and superior cerebellar artery, but what you see, this nerve is actually a content of interpeduncular fossa. It comes out of the interpeduncular fossa and then it runs between these two arteries here. So infundibulum, tuber cinereum, mammillary bodies, posterior perforating substance, and remember third nerve. These are the contents of interpeduncular fossa. So guys, this is about the ventral aspect of the brainstem here. Just a few more things to mark here. Like, I mean, you can see olfactory bulb over there. That's the olfactory bulb. And this is the olfactory tract. You can see the olfactory bulb just Above this olfactory bulb, we can and tract, we can see this gyri recta or rectus gyri, the straight gyrus that is called as a gyri recta. So this is the thing. At least these things you should be able to identify when you see this aspect of the brainstem. Okay, now it's time to turn the brainstem, guys. Once you turn the brainstem and we remove the cerebellum, removal of cerebellum means exposing the floor of the fourth ventricle. So that is our next section here, in which we'll be looking at the floor of fourth ventricle by turning the brainstem and removing the cerebellum from it. Okay, here is a picture showing the dorsal aspect of brainstem. See, it's not as simple as the way it looks like in the schematic line diagrams. We can see facial colliculus and sulcus limitans and locus ceruleus and whatnot in the floor of fourth ventricle. But when you see the real-time section, those elevations are not that clearly, differentiated. But we should be able to identify them because you never know where the pointer may be in the exam. Okay. One thing, guys, when you turn the brainstem and once you remove the cerebellum, the fourth ventricle is seen, and fourth ventricle is present behind the pons, and some part is behind medulla oblongata. But there is no part of fourth ventricle which is present behind the midbrain. So even if you remove the cerebellum, the one portion of the brainstem which will not be distorted or will not be disturbed at all is a midbrain. So right now, if you look at this portion here is a midbrain part, and the dorsal part of the midbrain, as you all know, is called as a tectum. Tectum is made up of two colliculus. This here is the superior colliculus, and just below that is an inferior colliculus here. So you're looking at the superior and the inferior colliculus. That's the superior and the inferior colliculus. If you look at this white matter bundle here coming from inferior colliculus, that is just basically called as the inferior brachium. This white matter bundle is called as inferior brachium, which will connect the inferior colliculus to the medial geniculate body. I hope you know that superior colliculus is related to the visual pathway, so it should be connected to the lateral geniculate body, and inferior colliculus is one of the component of the auditory pathway, so it need to get connected to the medial geniculate body. So it is getting connected to medial geniculate body by this white matter bundle, which I hope you can appreciate in this picture. That is called as the inferior brachium. For inferior colliculus, inferior brachium. For superior colliculus, it's superior brachium. Okay. Here's the portion from where the cerebellum is removed, and that's how you can see the floor of the fourth ventricle. Now please understand this. The three part of brainstem, they are having the three peduncles: the superior cerebellar, the inferior cerebellar, and middle cerebellar peduncle. Peduncle is nothing, it's a white matter only. So white matter bundle which is connecting the brainstem to cerebellum is superior, middle, and inferior, because we have three part of brainstem. But see, it's not like that superior peduncle goes straight into the cerebellum or inferior goes straight into the cerebellum from the midbrain and pons on medulla respectively. The superior peduncle actually that goes downward. So what you'll see in this picture here, midbrain is here, but the peduncle of the midbrain, the superior cerebellar peduncle is here. Can you see that section over there, guys? This is the superior cerebellar peduncle. So clearly you can see this white matter bundle is coming slightly downwards. That's a superior cerebellar peduncle. Medulla oblongata is in this region. That's a medulla oblongata here. So you can see from the medulla peduncle that is coming up, look at this section here. This is inferior cerebellar peduncle. And that peduncle that you see more on the outer aspect, that is a middle cerebellar peduncle, which is a peduncle of the pons. So although major chunk of the fourth ventricle is present behind the pons, but in the boundary of the fourth ventricle, middle cerebellar peduncle is not playing a role. It's a superior cerebellar peduncle comes down, inferior peduncle goes with it, and middle stays more outside here. And that's why the boundary of the fourth ventricle is by superior cerebellar peduncle and inferior cerebellar peduncle, and it is also by these two tubercles here. Now I hope, can you see this tubercle here? That is a tubercle of the medulla, and there's another tubercle here. Let me mark it for you guys. This tubercle, which is more laterally, this is more medially. The one which is present more medially here, this is called as a gracile tubercle. It's a gracile tubercle. And the one which is more laterally placed, this is called as a cuneate tubercle. With the name you can make out the gracile and the cuneate, the fasciculus gracilis and fasciculus cuneatus, the two dorsal column tract. Dorsal column tract is having one property, that they keep on ascending on the same side of the spinal cord, unlike spinothalamic tract which decussates. So these dorsal column tract, they will reach the medulla oblongata, and in the medulla oblongata they have their nucleus called as nucleus gracilis and nucleus cuneatus. That's why this nucleus. That's why these tubercle there. So deep to these tubercles, we have those two nuclei present called as a nucleus gracilis and nucleus cuneatus, where the dorsal column tracts are coming and relaying there. And from there, the second order neuron for the dorsal column tract will begin. So this tubercle here, the gracile tubercle is having a gracile nucleus or nucleus gracilis deep to it. And this cuneate tubercle is having nucleus cuneatus present deep to it here. They are also considered in the boundary of the fourth ventricle. So when it comes to the boundary of fourth ventricle, it's a superior cerebellar peduncle, inferior cerebellar peduncle, not the middle, and the two tubercle, that is a gracile tubercle and cuneate tubercle. Okay, now when we go, again before going inside the floor of the fourth ventricle, we already said, guys, the only nerve coming from the dorsal aspect of brainstem is what nerve? Fourth nerve, the trochlear nerve. So look at this, below inferior colliculus, can you see that very fine, the thinnest cranial nerve coming out in there? That nerve here is the trochlear nerve. The trochlear nerve, as you can see, it decussates within the midbrain only, and then it emerges out and will be coming out from the dorsal aspect of brainstem. And because it comes out of the dorsal aspect of brainstem, it has to wind around the brainstem and go forward. It not only is a thinnest cranial nerve, it is a nerve with the longest intracranial course also. Okay. In the floor of fourth ventricle, look at this sulcus present in the midline, guys. This sulcus here is called as a median sulcus. This sulcus is a midline sulcus here, and that sulcus is called as a median sulcus. Just lateral to median sulcus, this elevation, look at this where I'm pointing at right now, this entire elevation is called as a median eminence. First of all, guys, please remember this entire elevation is called as a median eminence. And on the median eminence, in this lower part of median eminence, this prominent elevation on the median eminence is called as the facial colliculus. That's a facial colliculus. So when you see a real-time section, it's not that easy to differentiate between the median eminence and facial colliculus. The way we draw it in the schematic diagram, it's very clear. We just show the median eminence and then we show something very circular which looks is a facial colliculus. No, nothing like that. It's not that simple. So this is a median eminence, guys, and this elevation on it, this here is the facial colliculus. This, to be more precise, that's the facial colliculus here. See, there is a sulcus on the side, on the outside here, which is again cannot be seen very clearly in this section here. The sulcus is called as sulcus limitans. And that is a sulcus which divides the neural tube into the two parts. Medial to sulcus limitans, we have majority of the motor nuclei placed. Facial colliculus is because of the facial nerve winding around what nucleus? It's the abducens nucleus. The nerve winding around is facial nerve. If there is injury to facial colliculus, first the facial nerve will be involved. That's a question also asked here. But if the question is asked, what is the nucleus present deep to the facial colliculus? That is obviously the abducens nucleus. It's a 6 nucleus. The facial nerve makes an internal genu around this abducens nucleus to come out. And that's why there is a prominence formed here. That is why the name is facial colliculus, which is actually representing the internal genu of the facial nerve. We come in the lower part here, guys, somewhere in this region. Now look at this elevation here, usually called as triangle, and see one which is more inferior laterally placed, this one here. The one above here, this is called as a hypoglossal triangle, and the one present below is called as a vagal triangle. Respective nuclei are present here. The dorsal nucleus of vagus and hypoglossal nucleus are there. So the name is a vagal triangle and hypoglossal triangle. So this is a vagal triangle. The hypoglossal triangle, look at the point where I'm pointing at, and more inferior laterally here, this is the vagal triangle, hypoglossal and vagal triangle. Lateral to sulcus limitans is big area present on the outer aspect here. This is the vestibular triangle here. Vestibular triangle. And anyways, we said that sulcus limitans is separating the motor and the sensory part of the neural tube. So medial to sulcus limitans, all these nuclei are present medial to sulcus limitans only. As I said, sulcus limitans is not to be seen very well in this, but all these nuclei medial to sulcus limitans. So be it hypoglossal, the vagal, or the facial colliculus, which is having an abducens nucleus, all are motor nucleus. And lateral to this sulcus limitans, this big triangular region is because it is having a vestibular nuclei placed deep to it. So we call it vestibular triangle, which is a sensory. I hope you can also appreciate some transversely running fibrous, transversely running band over there. these fibers are actually coming from this median sulcus, then they run on the dorsal aspect, and then using the inferior peduncle they go into the cerebellum. Guys, these white matter which is running transversely is called as a stria medullaris. That is called as a stria medullaris. Stria medullaris. It is seen in the floor of fourth ventricle. These are the fibers which runs within the medulla oblongata. They come from the dorsal aspect of the brainstem. Then they come out of the sulcus here. That is what sulcus? That is median sulcus. And then they will run laterally using the inferior peduncle. This whole thing is the inferior cerebellar peduncle. That was a cut section only. So they use the inferior cerebellar peduncle to enter into the cerebellum. Stria medullaris. And look at this point here, this midline point here between this gracile tubercle, this inferior angle of this fourth ventricle here, this is called as the obex. O-B-E-X, that is obex. So these are the things that you should be able to identify when you're looking at the dorsal aspect of brainstem. Midbrain, no problem, it will look completely intact. The two colliculus can be seen. You can see the fourth nerve just below the inferior colliculus. You can see the fourth nerve coming out. In the floor of fourth ventricle, in the boundary part, the superior and the inferior cerebellar peduncle, middle stays outside, and the two tubercles, the gracile tubercle and cuneate tubercle, also forms the boundary part. Midline sulcus is median sulcus. You will see a median eminence also, and on the median eminence in the lower part, you will see the facial colliculus, which is formed by the facial nerve winding around the abducens nucleus. Hypoglossal and vagal triangle are also to be seen medial to sulcus limitans, and laterally we have this big triangle here, that is because of the vestibular triangle, also called as a vestibular area. That is about the dorsal and the ventral aspect of the brainstem. So next, guys, we'll start with the sections here. So as I said, we'll take three sections, the three basic sections that you should know. The transverse section, we'll consider transverse section slightly higher and lower from the middle part as well. And we'll take a coronal and a sagittal section also. So basically, we should be able to identify these structures in these sections, because most of the time the questions are targeted on the structures which are pointed at. So our first goal is to identify that structure. Imagine if the fornix is marked in a coronal section and the question is asked on it. So first we should be able to identify whether it is fornix or something else. So that's the basic goal here, is to identify the structures in these sections. Now guys, this is a transverse section in which you can see the right and the left half of the cerebrum. Now this half is slightly higher, the section is taking slightly above, and this is a bit lower section here. So I'm going to start with this section here, which is slightly higher, in which you cannot very clearly differentiate between the lentiform nucleus, cannot be seen in fact in this. So, and this is the section which is taken at the level of the lentiform nucleus. So if I want to start with this part here, with the right section here, I just want to focus at the 3-4 major features that you should be able to appreciate here. When you take a transverse section through the corpus callosum, the corpus callosum is shaped something like this, right? So when you take a sagittal section of corpus callosum, transverse section of the corpus callosum, then you will see the section will go something like this. It will go from the genu, which is most anterior part, and the splenium being the most posterior part here. So this region here is somewhere the genu part of the corpus callosum in the transverse section, and this has to be the splenium part, which is even lower. But look at this white matter coming from the genu, and this white matter bundle running forward and connecting the frontal lobe. These fibers are called as the forceps minor fiber. Corpus callosum is the largest commissural fiber. Now, despite of being the largest commissural fiber, it cannot connect everything in the two cerebral hemisphere if the fibers were running only transversely and not moving forward or backward or downward. So they have to have some kind of adaptation in the fibers of corpus callosum. The fibers which are present in the anterior part, in the genu, they are not only running transversely, they have to go forward also to connect the frontal lobe. The fiber in the splenium, they have to go backward also, they have to go downward also to connect the temporal lobe, occipital lobe. So when you see the corpus callosum in a sagittal section, that is not giving you the overall idea about that how the fibers are spanning in the cerebrum. The transverse section is a better way to look at it. So this is the forceps minor fiber here, which is running forward. The fibers are coming from the genu of the corpus callosum, and they are connecting the frontal lobe. I'm just paying attention to this side here. What else you can see in this section, guys? This is the head of caudate nucleus. That's a caudate nucleus, and this is actually the head of the caudate nucleus that you see here. And just behind that, another piece of gray matter that you see just behind that, it is actually again the caudate nucleus, but this is the body. Please understand, guys, caudate nucleus. The nucleus is something like this. We all know that it's a comma shape, the caudate nucleus. If this is a caudate nucleus, if I take a transverse section somewhere here in the lower part, in this region, then I will see the head of the caudate nucleus, and that's it. But if I take a section slightly in the upper part here, so the section will go from the head of the caudate nucleus and also from the body of the caudate nucleus as well. So because this section is slightly above the upper part, so I can see the caudate, and along with that I can see the head as well as the body of the caudate nucleus as well. Whereas you see on the other side here, I can only see the head of the caudate nucleus. This is not the body. This is actually thalamus on the other side on which the caudate nucleus is running. If this is a caudate nucleus, there is a thalamus here. You getting my point, guys? If this is caudate nucleus, that is a thalamus. If I take a section from above in this part, I'll see head and the body both. But if I take a section in this part here, I'll see head and the thalamus in the lower part. This is thalamus here. And this is not the section of thalamus, the rounded thalamus. You can see the upper surface of thalamus, which is more rounded here. Unlike here, where the thalamus is actually cut. There's a rounded surface. You can see it is the upper aspect of the thalamus. And if you can see very carefully, there's a vein which is present here. You can see it in the revision slide also. That vein here running on the thalamus is called as a thalamostriate vein. There's a vein that you see running on it. That vein is called as a thalamostriate vein. You can also appreciate the choroid plexus in this section. The choroid plexus can be seen. That's a site of the, we have a lateral ventricle in this region, which is having an anterior horn, which is having a posterior horn as well. So that's a choroid plexus which you can see. The choroid plexus of the lateral ventricle can be seen in there as well. So this is when you see this right half, which is a section taken slightly higher. The section which is of more use and the chances of again the questions to be asked more is on this side here. So we have more things to appreciate on this side. So let me again take a fresh image for that to discuss that level. There we go. So same transverse section, just that we have just removed that higher one. We're just looking at the section from the middle part where the lentiform nucleus can be seen. So guys, see, this is again forceps minor. I don't have to mark it. This is the forceps minor fibers here. Here is the caudate nucleus. And this, you know that is what? That is a head of the caudate nucleus. That is a head of the caudate nucleus. If I just put a dotted lines for you, this is the caudate nucleus here. This time, the section is slightly lower, so it's not the upper aspect of the thalamus. You're looking, the section is going through the thalamus. So that's a thalamus here. And lateral to it, this here is the lentiform nucleus. Look at this lens-shaped nucleus, the lentiform nucleus. This nucleus, just let me mark it here only. This is called as a lentiform nucleus. In other section, I'll tell you that what two parts we have. We have putamen also and globus pallidus. So in this, we can just appreciate that's a lentiform nucleus. And let me try to enlarge it a bit more. I hope you can appreciate just lateral to lentiform nucleus. You can see a very, very thin sheet of gray matter over there. A very, very thin sheet of gray matter cannot be appreciated radiologically. That is called as a claustrum. That's a claustrum over there. And most laterally, this gray matter that you see most laterally here is an insular cortex. That is insula. I hope you all know about the insula, the hidden area of the brain called as the insula, also called as the island of Riehl. This is also called as the island of Riehl. The insular cortex, the insula, or the island of Riehl. Whatever I marked till now here, all these are the gray matter here. The head of caudate nucleus, thalamus, the lentiform nucleus, the claustrum, insula, that's all gray matter. Now look at the white matter in between. One white matter you already saw, that is a forceps minor here. Now this white matter which is running in this manner here, this is internal capsule. So guys, this here is the internal capsule, which also tells you about the relations of internal capsule. That's the anterior limb of the internal capsule between the head of caudate nucleus and lentiform. That's a genu part. And that is a posterior limb of lentiform nucleus, of the posterior limb of the, internal capsule, which is between lentiform nucleus and thalamus. And behind the lentiform nucleus, we can see some part, this is called as a retrolentiform part. There is a retrolentiform part of internal capsule. Let me take your attention to this portion only here. If I look at this portion, guys, what you'll appreciate here, you can see the posterior horn of the lateral ventricle. Lateral ventricle is quite a three-dimensional structure, isn't it? Lateral ventricle is like having this anterior horn, inferior horn, as well as a posterior horn. So if I took a transverse section in such a way that I can see this horn here, that is a posterior horn of lateral ventricle. Here it is, that is a posterior horn of lateral ventricle. That is a posterior horn of the lateral ventricle. Medial to the posterior horn, you will see the fibers which are coming from the corpus callosum, Even lateral to that, we are again seeing white matter which is also coming from corpus callosum. The one that you see coming from the genu, that was forceps minor. Now these fibers which are running backward here, medial to the posterior horn, these fibers are called as forceps major fiber. Look at this white matter bundle. It will be coming from the splenium of the corpus callosum. From the splenium of corpus callosum, the fiber will go backward to connect the occipital lobe and all. This is called as a forceps major. And forceps major, please mind it is present medial to the posterior horn. In fact, these forceps major fibers, they're such a dominant fibers we have that they produce this elevation in the medial wall of the posterior horn, and that elevation is called as the bulb of posterior horn. This again could be a question here. The bulb of posterior horn is because of what? Bulb of posterior horn is because of the forceps major fibers. The bulb of posterior horn is because of forceps major fibers. When you see lateral to it, now look at this, guys. Lateral to this posterior horn, this is choroid plexus inside. Just don't bother. That's a choroid plexus present inside. Now, when you see lateral to the posterior horn, you can see a white matter here. In fact, it's a combination two white matter. If you see the white matter which is just lateral, just immediately lateral to this posterior horn, this here is called as the tapetum. Tapetum is a white matter bundle, part of corpus callosum only, coming from the posterior part of body and the splenium, and they are seen running lateral to the posterior horn. Forceps major was present on the medial side of posterior horn. These fibers are also coming from splenium and the posterior part of body of corpus callosum, but they are running lateral to posterior horn. And guys, immediately lateral to the tapetum, another white matter bundle which is a bit difficult to segregate from this, which is more outside here. This is actually optic radiations. These are optic radiations. See, makes sense. Visual cortex is present behind. Area number 17, 18, 19 is present behind. So visual radiation, optic radiations will come from where? It will come from the lateral geniculate body. Where are lateral geniculate body? They're just behind the thalamus. Where is thalamus? This is the thalamus here. So behind the thalamus, you cannot see in this picture though, that behind the thalamus, there will be the medial and lateral geniculate body. And from the lateral geniculate body, the radiations will come and those radiations will go to the visual cortex. These are called as optic radiations, also called as posterior thalamic radiations. They run backward and they're coming from metathalamus, that is a geniculate body. So we also call them posterior thalamic radiations. So this again are the structures that you should be able to identify in this section. Internal capsule, and the relations of internal capsule is quite clear here. The caudate nucleus, the head of the caudate nucleus, the thalamus and the lentiform nucleus present laterally. Lateral to lentiform nucleus is a claustrum. Appreciate the white matter here, that is an internal capsule. And just to add one more thing to it, guys, this is called as internal capsule. See, the nomenclature of this internal capsule and external capsule is based on the basal ganglia. The one which is present inside this lentiform nucleus, inside the basal ganglia part, that white matter is called as internal capsule. The one which is immediately outside here, but inside the claustrum, I don't know if you can appreciate that in this picture, but you can see a very, very fine white matter which is outside the lentiform nucleus, but inside the claustrum, that is called as an external capsule. And the one which is even further out, which is outside the claustrum, is called as an extreme capsule. The external capsule, and this is an extreme capsule. Then in the posterior part, we noticed the posterior horn of the lateral ventricle. I always believe that this down the line could be a question, the posterior horn of lateral ventricle and its relations. The medial relation is the forceps major fiber, again coming from splenium. Immediate lateral relation is the tapetum fibers, and more lateral to tapetum, we have the optic radiations coming from the lateral geniculate body to the visual cortex. So again, this is something that you should be able to identify in the transverse section. I've recently come across some questions in which the transverse section is given, but that transverse section is given from slightly lower part here. So I want you to anticipate this thing, guys. When you take a transverse section even further, even more in the lower part here, what you will see there and what you'll miss. Let me put that section for you because that's the exact image which I got from some of the students and I've used that image only here. Here's the one. Again, it's a transverse section, but there's some changes that you can see in there. What changes I can see here, I cannot very clearly appreciate the anterior posterior limb of the internal capsule and all that. I cannot very clearly see the thalamus on here. So this section is quite low. It's obviously below the thalamus and all. What I see in this section here, once again, the head of the caudate nucleus is to be seen. This is the head of caudate nucleus. That's the head of the caudate nucleus. And look at this gray matter here. What according to you this gray matter could be? This gray matter, guys, is actually the cingulate gyrus. That is cingulate gyrus. Now let me just try to give you orientation around it. When you look at the corpus callosum, that's a genu and that's a rostrum of the corpus callosum. That's how it is. There is a gyrus which runs above it that is called as cingulate gyrus and turns in that manner. Cingulate sulcus, and there is a gyrus called as cingulate gyrus present around the corpus callosum only. You know, corpus callosum, despite of being the largest commissural fiber, it is not able to connect everything in the two cerebrum. So we need some small additional commissural fibers also. Below the rostrum of the corpus callosum, what you will see another commissural fiber there, and that commissure is called as an anterior commissure. Please understand this point clearly. That's a corpus callosum, and below the rostrum of corpus callosum, there is a small commissural fiber, which I'll show you in the sagittal section, is called as an anterior commissure. And fornix is running something like this. Fornix is running in this manner, which again I will show you in the sagittal section. So I can see corpus callosum here. I can see this gyrus that is called as a cingulate gyrus, and below I can see the fornix, and below the rostrum of corpus callosum there is this anterior commissure which is present. This is the, if I just mark it clearly here, this is the anterior commissure. If I take a section like this, imagine if my transverse section is going that low. So what I will see here, if I go section in this manner, that means first of all in the anterior part I will not see the corpus callosum. Corpus callosum rostrum is finished here, and I've taken a transverse section even below the rostrum of corpus callosum. But what three things you are able to appreciate here, and in the sequence, is what gyrus first? The cingulate gyrus. What behind that? What commissure? The anterior commissure. And what behind them is the columns of the fornix. You can see that that's a fornix over there. Okay, let me take you to this part here and let's see this thing here. Section going from this gray matter, this is actually cingulate gyrus. The cingulate gyrus. Then we have to see what? The anterior commissure, and behind that should be the columns of fornix. Behind this cingulate gyrus, look at this white matter bundle running transversely like this. This is the one which is pointed out in one of the exam also recently. And that's the main thing, guys. This is anterior commissure. This is anterior commissure. And what is the function of anterior commissure? It actually connects to some part of the temporal lobe. It actually connects the amygdala. It connects the amygdala. Remember that? I've written in the revision slides also. The anterior commissure, which is present just below the rostrum of corpus callosum, the function is to connect some component of temporal lobe, and that is they're connecting the amygdala. Have a role in play in the memory and the sex drives also. And I hope you can appreciate in that. Can you see the two white dots over there? Look at that. Just behind the anterior commissure, if you look at these two dots here, what is this to be? These are the columns of the fornix. That's a column of the fornix here. So this is something which I wanted to understand in this section, which is taken quite low. If you compare it the previous one, the section is taken somewhere below the corpus callosum, imagine. So you're looking at this cingulate gyrus, that gray matter is cingulate gyrus. Behind that we have, what is this? This is the anterior commissure, and then behind the two dots over that you see here is actually the columns of the fornix. The section is going in this manner, so it looks like the two dots only, the columns of the fornix. In this section, what else we can appreciate here well is the lentiform nucleus. I can see the three part of the lentiform nucleus very clearly here. 1, 2, 3. You can see 1, 2, 3. The three part of lentiform nucleus, if I just give them 1, 2, and 3 here, the most lateral part here, guys, that is number 1, that is putamen. 1 is for the putamen. 2 and 3, one slightly lightly stained and darkly stained, that is 2 and 3, both are globus pallidus. That is a globus pallidus or globus pallidum. Number 2 is globus pallidus lateralis. We call it pars lateralis. And that is globus pallidus pars medialis. So you can see this, the parts of the lentiform nucleus there. The outermost part obviously is the lentiform, this is the putamen, and then we have a globus pallidus, which again can be divided in two parts, the pars lateralis and the pars medialis. So that's one variation that you will see in this section. This section also shows the claustrum very clearly, if you can see. Can you see the claustrum over there? And you can see the white matter inside the claustrum and outside the claustrum also the same, external capsule and the extreme capsule. So just look out for the transverse section, whether you're looking, are you able to see the caudate nucleus and along with the thalamus can be seen? Can you see the posterior horn of the lateral ventricle in it or not? So like these small things, that small hint that will work, and you need to identify. This is one of the thing in this section which I always believed is important, and they asked this question also as an image based question, that is anterior commissure connecting the amygdala. So guys, this is about the transverse section. I hope you should be able to identify at least all the major structures in these transverse sections. Now from the transverse section, let's now move on to the coronal section, and in that coronal section we'll also be covering the lateral ventricle. So guys, here you're looking at a very nice high definition image of the coronal section of the cerebrum, and this section is actually going from the body of the the lateral ventricle. So it's not the anterior posterior horn. This time you'll be looking at the body part. That's a lateral ventricle, and the section is going from the body. Well, let's first mark the things that we already saw in the transverse section. That's another view of that. This here again, that is the internal capsule. Look at this white matter here. That is the internal capsule. Let me mark all these things on one side here. That is internal capsule. And once you see this internal capsule reaching the level of the corpus callosum, can you see the white matter clearly? And once it reaches the level of the corpus callosum, it radiates in the cerebrum, and that's how we call it what? Corona radiata. The internal capsule, once it reaches the level of the corpus callosum, then you see it radiating and going into the respective part of the cerebrum, that is called as corona radiata. Before I go to this portion here, the important part, I wanted to focus on this lower part, guys. The three part of brainstem can be seen here. That is a midbrain here. There is pons, and that is medulla oblongata. A few hints in there. Look at it. If this is a midbrain part, first of all in the midbrain, look at this, a stained region here, that is substantia nigra. So substantia nigra can be seen there. This portion is a portion of pons in direct contact, the direct relation to the cerebellum. There is a pons here. And below here, this is medulla oblongata, and you can also appreciate the two important elevations of medulla oblongata, although you cannot see what is deep to them very clearly here. Look at this. Can you see this one elevation here and one elevation in front here? This elevation is because of inferior olivary nucleus, and we call it olive. And this elevation here, the ventral part, that is called as pyramid. That that is because of the pyramidal tract or corticospinal tract. So in the medulla oblongata, in this section, I can see this. That is the olive here, and that more ventrally placed. This is a pyramid. This whole thing is a pyramid. You can see the longitudinal view of the pyramid as well. Okay. Now going to the upper part, here is the lateral ventricle. This here is the lateral ventricle, and the one here is the third ventricle. That is the third ventricle. We already will see the third ventricle in the next section, but this section will help you to understand the next one also. Once again, guys, before we go to the boundary of this lateral ventricle or the third ventricle, now if this is the internal capsule, can you see this grey matter lateral to internal capsule here? This once again is what? That is a lentiform nucleus. And lateral to lentiform nucleus, look at this grey matter here. This was the section asked in the AIIMS exam in which they gave a coronal section and insula was asked. So this here is the insula. In the coronal section, the insula, the hidden cortex. Until unless you open this lateral sulcus, you are not able to see this area. That's why we call it a hidden gyrus here. The insular gyrus or insular cortex here. You have to go through this lateral sulcus, open it up, the sylvian sulcus, and then you can actually reach and see all those, all that area that is called as the insula. So lateral to internal capsule is what? Lentiform nucleus. What about medial? Medially, again, we have what? That is a caudate nucleus. And this time it's a body of caudate nucleus. It's a coronal section, guys. And it's a coronal section not from the anterior part. If this is the caudate nucleus, the section is not very much from the anterior part. It is from the body of the lateral ventricle. So this time you'll be looking at the body of the caudate nucleus only, not the head. So that's a caudate nucleus, and below we have a thalamus. That's a caudate nucleus thalamus. That's the only thing is this time you're looking at it in the coronal section. Talking about the boundaries of the lateral ventricle, what do you see? This is a median fissure, right? That's a median fissure. And here clearly is the corpus callosum. That's the corpus callosum, which is the connecting the two cerebral hemispheres, the largest commissural fiber. And corpus callosum is one major structure forming the roof of the lateral ventricle, as you can see. So corpus callosum is forming the roof. Medial wall is by this a very thin septum here, and this septum is called as septum pellucidum. Again, I'm just labeling it randomly here. It's all clearly labeled in the revision slides. That is septum pellucidum, and that's a major medial wall here, the septum pellucidum here. And then majority of the structures here are forming the floor of the lateral ventricle. So we don't consider a lateral wall. We simply say we have a roof, we have a medial wall, and we have this floor of the lateral ventricle. And as you can see, the floor of lateral ventricle is by the caudate nucleus, the head of the caudate nucleus. That is a head, right? Then it is by a vein in between. Can you see a vein between the thalamus and the caudate nucleus called as a thalamostriate vein? I showed you this thalamostriate vein in the transverse section also. A higher transverse section in which you saw the thalamus and there was a vein running on it, that is a thalamostriate vein between the thalamus and the corpus striatum. So the name is thalamostriate vein. This, of course, is the thalamus. And this here is the fornix. That is the fornix, the body of the fornix can be seen. Previously, we saw the columns of the fornix, which is the anterior part. That's a body of the fornix. Another previous year AIMS question from here, in which they gave a coronal section also only, and in that coronal section they put an arrow on the fornix, and the question was that following fiber originates where? Well, we should first know what is the following fiber. So the first job is to identify what the arrow is on. So arrow was on the fornix here, and that fornix, and see there are two fornix here which come very, very close to each other, looks like a single unit only, and they go downward and they end in the mammillary bodies. So if the question says where the fornix fiber originate from, they originate from hippocampus. Where they end in mammillary body. Originates in hippocampus, ends in mammillary body. The fibers are going forward like this and they ends in mammillary bodies. And you can also see a plexus over there, if you could appreciate in this picture here. Can you see the plexus? That is a choroid plexus here. The choroid plexus of the lateral ventricle and the choroid plexus of the third ventricle here. So that's a choroid plexus. If I get a space to mark it here, this is the choroid plexus. So all this is the floor here. The caudate nucleus, thalamus, thalamostriate vein, choroid plexus, they are all forming the floor of this lateral ventricle. Medial wall is by the septum pellucidum and the roof is by the corpus callosum here. So previously in the dorsal aspect of the medulla oblongata of the brainstem, we saw the fourth ventricle boundaries, and fortunately in the coronal section we can cover up the boundaries of the lateral ventricle here. So whether it's a theoretical question or it's on image based, you should be able to identify these structures in this section here. Okay, one more section that we'll take here. We're done with the coronal, we're done with the transverse, and now finally we'll take a sagittal section to wrap up this session. In the sagittal section, guys, we will be looking at the corpus callosum part. We'll be looking at the other commissural fibers also, and most importantly, we'll be looking at the boundaries of the third ventricle also. Okay, here is the sagittal section that we'll be considering. Now, before I discuss the structures which are forming the boundary of this third ventricle and about the aqueduct of sylvis and lateral ventricle also to be seen here. Guys, this here is the corpus callosum, right? And if this is corpus callosum, going with the parts of corpus callosum, we have this body of the corpus callosum. This is the genu part anteriorly placed. There is a splenium here, and below we have the rostrum here. So that's a rostrum here. I'm just telling you that is a rostrum region. In this section, a septum is removed from below the corpus callosum. The septum that we saw below the corpus callosum was septum pellucidum. This is septum pellucidum. I'm just using a different image here to show that how the septum pellucidum look like. That's a corpus callosum. That's a fornix here, right? That is a fornix. Look at that. That's a corpus callosum. This is the fornix. And look at this translucent septum in between. That is a septum pellucidum, which is forming the medial boundary of both the lateral ventricles. So the section that we're looking at, in which the septum pellucidum is not seen, but the other structures can very clearly be appreciated. So let me go back to that. It is just to show you the correlation in between. Coming back here, the sulcus, see, that was the sulcus I was talking about. This was a cingulate sulcus here, and that gyrus is called a cingulate gyrus. This gyrus here is a cingulate gyrus here. If this is a cingulate gyrus, coming back to that same point, if this is a cingulate gyrus, that's a rostrum of corpus callosum. Here is the anterior commissure. Can you see that commissure over there? If I can show it to you, this enlarged. Look at this. Look at this. The cut section of this anterior commissure, and just behind the anterior commissure, you can see the column of the fornix as well. Look at that. That's a column of the fornix here. Let me mark both for you. This here is the column of fornix. That commissure is the anterior commissure. And just below the anterior commissure, guys, this here is called as the lamina terminalis. That is lamina terminalis. That is lamina terminalis. Well, all these three structures, the column of the fornix, anterior commissure and lamina terminalis, they are forming the boundary of the third ventricle. Where is third ventricle here? That's the third ventricle. This picture is showing the third ventricle, and the anterior wall of third ventricle, look at this, it is by the three things here, the column of the fornix, it is by this anterior commissure and by the lamina terminalis. I think you should not bother about the roof that you already know. In the coronal section, we saw that below the septum pellucidum, we have the fornix, and below the fornix was the choroid plexus. That means this fornix will be there here, the body of the fornix will be somewhere here. This will be the body part of the fornix here. And then we have the choroid plexus also. So body of the fornix and choroid plexus will be in the roof. Posterior wall. What is there in the posterior wall? Below the splenium of corpus callosum, you can very clearly appreciate this gland here. That is a pineal gland. That's a pineal gland. And if you look carefully, guys, just below the pineal gland, there is a commissural fiber present below, and that commissure is called as a posterior commissure. The commissure which helps to connect the superior colliculus and accessory oculomotor nucleus, that is called as a posterior commissure. It is below the pineal gland, or you can say it is present in the inferior lamina of the pineal gland. Pineal gland is having an inferior lamina and the superior lamina. Superior lamina is not very clearly seen here, but superior lamina will be here, and that superior lamina will be having a commissural fiber that is called as a habenular commissure. It's a habenular commissure present in the superior lamina of the pineal gland. And just below posterior commissure, guys, if we already said if this is a third ventricle, this we already know it is a fourth ventricle which is present behind the pons, right? That's a pons here. This is medulla oblongata, that is cerebellum, this is midbrain. Right? So if this is a fourth ventricle, then obviously this is the aqueduct of Sylvis. So that's the fourth thing, the aqueduct of Sylvis. That's the aqueduct of Sylvis, which is also forming the posterior wall. So anterior wall of the third ventricle is by what? It is by the column of the fornix, it is by anterior commissure, and it is by the lamina terminalis. Posterior wall in a sequence, looking at the present scenario, you should also know the sequence of the structures as well. Posterior wall is by what? Habenular commissure, the pineal gland. We got this posterior commissure, and then we have this, what? That is the aqueduct of Sylvis. Roof we already said that is by the body and that is by the choroid plexus. Okay. Floor. Coming to the most important thing, there is a floor here, guys. Let me take you back to interpeduncular fossa. The first image that we discussed was of the interpeduncular fossa. I told you, if you know the floor of the interpeduncular fossa, the content in that, then you know the floor of third ventricle also. If you remember all the structures present in the midline, in the interpeduncular fossa, it was what? Optic chiasma was there. Just behind optic chiasma, there was an infundibulum coming out of tuber cyanidum. Just behind that, what? There was a mammillary bodies. and we also have posterior perforating substance. If you just go back and think about the interpeduncular fossa, whatever I just said, they are the structures present in the interpeduncular fossa. The optic chiasma is the boundary. Behind that, we have the infundibulum and tuber cinereum, the mammillary bodies, and the posterior perforating substance. Third nerve is also there in the interpeduncular fossa, but then let's ignore the third nerve because that is going actually more outside. Okay. Keeping those structures in the sequence in mind, now look at this picture. Let me just rub this off. Anyways, it's there in the revision slide. And I wanted to focus on the floor here, guys. The floor in the sequence, if you see this picture from this side, from this aspect, from the inferior aspect, then it is interpeduncular fossa. But when you see these structures from this aspect here, that is forming the floor of third ventricle, and the sequence of the structure is the same. It's the optic chiasma. There we have it. Just behind that is infundibulum. I'm just writing I for the infundibulum. You can see that is the infundibulum. This is very clearly appreciated. That is a mammillary bodies. Behind mammillary body, that is the posterior perforating substance. That is a posterior perforating substance, remember, which was perforated by the branches of PCA. And then you can see some part of midbrain. See, the dorsal aspect of midbrain, which is present behind the aqueduct, was tectum. This part of midbrain is called as a tegmentum. So tegmentum of the midbrain can also be seen here. All these are forming the floor of the third ventricle. So remember guys, this I very strongly believe that the most important section is the sagittal section only. Even in this current aims also, there was a question asked on the fornix in the sagittal section only. So this, I believe, is a very, very important section. The third ventricle, its boundaries, the fornix, the part of corpus callosum can be seen. We can see the fourth ventricle. This is the posterior recess of the fourth ventricle extending backward. This triangular recess is called as posterior recess of fourth ventricle. So there's a lot to be appreciated in this section here. So if I may very, very quickly repeat this section for you. So this is the third ventricle here. Third ventricle, that is the lateral ventricle above, that is fourth ventricle below, that is third here. Anterior wall of third ventricle, three things. What three things, guys? That is what we have: a column of the fornix, we got anterior commissure, and then we got lamina terminalis. Posterior wall in a sequence: habenator commissure, pineal gland, posterior commissure, and then aqueduct of Sylvis. Roof, we saw it in the previous section only. That is formed by what? The fornix, the two fornix coming in there, and then we have a choroid plexus present below it. Floor, by the optic chiasma, infundibulum, mammillary body, posterior perforating substance, and tegmentum. Whatever you saw in the interpeduncular fossa, barring third nerve. There is no third nerve in the floor of the third ventricle. So that is there in the floor here. Whereas lateral wall, if I see, just let me rub this off here. If I again just kind of highlight it, or enlarge it for you, this elevation, guys, here is actually thalamus, and this here below is the hypothalamus. That is thalamus here, and this is hypothalamus, and you can see a sulcus also in between. This sulcus is called as a hypothalamic sulcus, which is guiding the CSF from interventricular foramen to the aqueduct of Sylvis. From the interventricular foramen to the aqueduct of Sylvis, that is the hypothalamic sulcus. They are present in the lateral wall of the third ventricle. The thalamus, the hypothalamus, hypothalamic sulcus, which is basically guiding the CSF from the interventricular foramen, which is here, to the aqueduct of Sylvis. So they are forming what wall? The lateral wall of the third ventricle. So this is about the some important sections of the brain that before going to the exam that you should know. I mean, the questions could be anything, guys. Question could be about the blood supply. Question could be about the whether it forms the boundary of the certain ventricle or not, or anything. But our first goal is to identify those structures. Even for the radiological images, if you can identify the normal anatomical sections, then only you can identify them on the radiograph as well. So that's all for this session, and in the next section we'll meet and we'll talk about the other small topics of the remaining part of the anatomy. Thank you.